You're thinking about deprescribing sedative hypnotics. That's great! In this video, discover how you can engage patients, choose viable alternatives to sedative hypnotics, and start appropriate tapering protocols. First, let's talk about why you'd want to deprescribe sedative hypnotics. There are many reasons, especially when it comes to treating insomnia in older adults. First, let's look at the benefits of sedative hypnotics. Patients might fall asleep faster. 14 minutes faster with benzos and 22 minutes faster with Z-drugs. But there's no clear evidence that Z-drugs make people sleep longer. Now let's look at the other side of this scale, the harms. Benzodiazepines and Z-drugs, both short-acting and long-acting, increase falls and fractures, hospitalizations, memory problems, and even death. The risk of car crashes doubles the day after taking a benzo, Z-drug, or trazodone. And harms aren't just linked to chronic use. Episodic or PRN use has the highest risk of hip fracture. With a number needed to treat of 13 and a number needed to harm of only 6, the harms of sedative hypnotics clearly outweigh the benefits. But how do we encourage patients to stop taking sedative hypnotics? It's not as hard as you might think. 70% of seniors are willing to deprescribe their meds. Here are 3 ways you can start the deprescribing conversation like a deprescribing superhero. The direct approach. Wow, you're on a lot of pills. Can we talk about getting you off one of them? The emotional approach. I'm worried about you staying on your sleeping pills. I don't want you to fall and break your hip. If you were my mother, I'd want you off them. The evidence-based approach. Have you seen the new research study linking sleeping pills to problems with memory and concentration? Find out what's important to your patients. If your patients are worried about memory loss, tell them that the sleeping pills are linked to memory loss. If they're at risk of falls and fracture, tell them that stopping the pills can reduce their risk of falls. If they value their driver's license, tell them that driving the day after taking a sleeping pill is like driving over the blood alcohol limit. In spite of all the risks, some patients will hesitate and provide a range of excuses. You can start by reassuring them that most older adults need only 5 to 7 hours of sleep per night. Next, present viable alternatives to sedative hypnotics, such as cognitive behavioral therapy for insomnia, which we call CBTI. It's more effective than medications at both inducing and maintaining sleep and has no side effects. Download our sleep diary for your patients and a brochure that explains how to do CBTI. Also, check out the great resources at Sleepwell Nova Scotia. If your patients are still not sure about deprescribing, propose a trial. Remind them that they can always restart down the road if they need to. Once your patient is on board, discuss the appropriate tapering protocol. The right tapering protocol can reduce symptom return or withdrawal symptoms. Benzodiazepines can be particularly tricky and require a tapering protocol over a few months. Be a deprescribing superhero. Download our Empower brochure and walk your patient through the tapering example. Tell them that they will definitely have a few nights of insomnia, but that it's worth pushing through the taper without stopping or going back up a dose, because eventually their bodies will remember what a healthy, natural night's sleep is all about. Over to you. What are you waiting for? Don't settle for the status quo. Don't automatically renew the next prescription. Use these helpful resources to become an effective deprescriber of sedative hypnotics.